Welcome back, everyone. I hope you've all been enjoying yourself at HMA so far. Just a reminder to take part in our contest. All you need to do is click on the contest tab on the platform for more information and on how to participate. But don't do that just yet, because up next, we'll be talking all about quality, patient safety, and accreditation in our new world. And there's no one better to talk about that topic than Dr. Karen Luxford, Group CEO, the Australian Council on Healthcare Standards and ACHS International. Welcome to HMA 2021, Dr. Luxford.
Thank you, Noah. Fantastic to be here and wonderful to be able to connect with colleagues all across the region. I'm very excited about this session and being invited today to talk on quality, patient safety and accreditation in the new world. And indeed, it is a new world for all of us, and particularly in relation to quality. We've seen many changes in the last nearly 2 years now, a year and a half, a year and about 18 months. And during that time, of course, the COVID pandemic has meant a lot of changes, particularly for the healthcare system. Certainly, we've seen 219 million cases at least of COVID in that period of time around the world, and unfortunately 4.5 million deaths. And so our healthcare system in that time has really had to adapt. It's been quite a difficult test. And we know that healthcare is fundamentally a human endeavour. And so it is open to the usual issues and complications that occur when humans are involved in a process. And it's certainly been very tested. And I think probably no more than the actual healthcare services that are providing care. And we've certainly seen that with our healthcare providers. Next, please. Our facilities have been extremely stretched in this period of time, and the healthcare clinicians in the many different facilities around the world are really performing to an absolutely stellar level. I particularly like this image with the healthcare providers and workers saying that, please stay at home because they come to work for us. In Australia at the moment, we are in many states in lockdown. I'm here in Sydney, and in Sydney and in Melbourne, we have an outbreak of the Delta variant, and so many of us are working from home, and our healthcare services are particularly stretched as they have been in a number of other countries. But safety is the absolute paramount for all of us, and it continues to be the key thing that we focus on through our work with ACHS International, and certainly has been at the forefront of the work with all of our healthcare facilities. Particularly infection control, as we've seen, as with this rise of infectious diseases, has been the critical thing that has been at the forefront of our approaches to safety and quality. We had very clear information coming out in Australia and to our members across the world about infection prevention and control very early on in the pandemic, and this still continues to be the mainstay of our response. What's been very interesting in this time is the way in which taking a wider health systems approach has enabled us to be able to really combat this infectious disease period. And the focus on quality and safety during the pandemic has really drawn on the lessons that we've learned from other times, particularly from outbreaks of Ebola and from SARS-CoV-1. Lots of our colleagues we've been talking to in Hong Kong in particular have had many learnings that can be drawn on for this particular period that we're all experiencing. And that's been used to strengthen our systems and the frameworks that we draw on. And going back to the work of WHO, these frameworks have really provided us guiding principles for how to respond in a quality manner during a pandemic, and certainly making sure we've got to focus on an adequate workforce, on having the right medical supplies and equipment. Strong governance, absolutely critical, and active information systems so that we can communicate effectively and in a timely manner, and having adequate health resourcing. Next, please. The keystone of our approaches to safety and quality continue to be the main emphasis even during this pandemic. So making sure that we are using the same sorts of approaches that we've always promoted in improvement. So strengthening the system, the environment, supporting patient and family and community engagement, improving the clinical care that is delivered, and reducing harm, particularly by proactively managing the risk not only for patients who have COVID, but for those who don't as well, and enhancing and expanding the learning system to develop resilience. This has been a great time of learning for all healthcare services. And we've seen a very rapid acceleration of innovation in this global pandemic. Initially, it'd be interesting to hear what people have experienced in their own countries, but perhaps the sort of resistance that we saw initially to online healthcare delivery certainly receded quite quickly at the beginning of the pandemic, and attitudes started to shift. We saw here in Australia that regulations were temporarily changed, but we are now seeing that some of those changes are actually coming into the normal long-term processes. So we saw a lot of change to funding models relating to telehealth provision. The government said that will just be a temporary change, but I think that it's been such a great success that they will be much more permanent. And certainly the kinds of transformations that people were planning for many years certainly only took a matter of weeks and days to come into effect. We've seen new models of care, hospitals in the home care and telecare have all rapidly been rolled out. But most importantly, from my perspective, is the safety and quality foundations. And these have really come to the fore at this time. We've seen many global emerging trends, as I mentioned, new models of care, new funding models starting to come into place. How do we actually fund these new models? Making sure that we're using technology to the fullest with smart technology and AI. Remote and virtual assessment, I'm going to mention that a little bit later. Data analytics, not only for the support of clinical decision making, but also in regulation, and tailored approaches to assessment, as well as the use of performance data. And I'll speak a bit further about that later on. But the central themes have remained infection control, medication safety, the rise of antimicrobial resistance, still very important, unwarranted variation, patient engagement, diagnostic error, and critically strengthening our safety culture. We know that underpins the approaches of organisations to safety and quality. Now, how do we make sure that we have a culture that is accepting of and promoting safety and quality? Key to all of this has been the standards that we apply to ourselves as health services. And in Australia, our national approach to standards and the work that we do internationally through our CRIP program has really meant that organisations are well set up to be able to cope with these sorts of crises. So ACHS has been working in this area since the mid-70s, and we introduced Australia's first safety and quality standards with EQUIP. So having that consistency well embedded has really stood our organisations in good stead. And the consequence of that we see is really reflected in a report that came out this year through the Commonwealth Fund, a philanthropic group, looking at the performance of health services in the international space. And we were very excited to see Australia rated number one in terms of our health outcomes and equity, and then rated quite highly in terms of administrative efficiency and overall ranking. And that's against some of the countries that spend a lot more of their GDP on healthcare. So what role has accreditation played in this time? We have noted, and it's been picked up in a number of international studies, I'm going to mention one of those in a minute, speaking to our members, that accreditation has given that underpinning of being responsive and providing safer care in these challenging times. So accredited facilities have been performing better in the pandemic, which is encouraging, and the approach to quality improvement has been key to that. Being better prepared, having the ability to cope, respond, be resilient, and also be ready in terms of being able to adapt during a time of crisis, and collaborating and cooperating. So here's some data out of an international study which looked at accredited versus non-accredited hospitals in this period of the pandemic. And accredited hospitals came up much more positively in this period because they had well-structured infection control. They were responsive in that they had established governance, established committees, could respond quickly, had policies and processes already in place. Their staff were well trained to cope with changes and the emergence of an infection, and having their emergency preparedness plans in place was really critical for that. The accredited hospitals, and this certainly is backed up by the members that we've spoken to for ACHS International, were really being sought after as facilities to provide guidance and advice to others who perhaps were less prepared. Thank you. The future of accreditation, where to from here? We have seen quite a bit of change in this period of time. We very quickly moved to virtual and hybrid assessments using digital platforms. We did this by adapting new methodologies and procedures to accommodate the new world. And we made sure we had our assessors trained and supported to be able to focus on this new approach. And most importantly, the safety of the organisations that are being assessed and the assessors is paramount. And we've certainly seen groups such as the International Society for Quality in Healthcare, ISQA, start to look at what will the future of accreditation actually look like. And this is a paper that was published by ISQA fairly recently, looking at what will that future hold. And these are the sorts of things that they said should be a feature of a future in accreditation. So evaluation and external evaluation continues to be important. Having an independent set of eyes on your healthcare service and making sure that safety and quality is up to scratch. We are doing some interesting work looking in Australia, and I'll mention that just at the end, about automated auditing and seeing how we can use data in the real time. And fundamental to that is having the right sorts of indicators and programs in place to be able to measure performance. We have a clinical indicator program through ACHS International with 330 plus clinical indicators that is provided complimentary to our members, and it has been developed with the backing of the professional colleges within Australia and New Zealand. And we support that through a range of webinars and other activities. Next, please. So these indicators cover 21 different clinical areas and provide for international benchmarking and trend analysis so that you can compare your performance against other healthcare facilities. Next, please. So just in conclusion, where we're seeing this area heading is really drawing on the capabilities of digital health and being able to not only assess remotely, but also using performance data in a timely manner, preferably real time if possible, but more timely, and certainly having actionable data that can be used to support the accreditation process in real time, we believe will be key in the future. So we recently joined a large project in Australia, which is researching this whole area through the Digital Health CRC Cooperative Research Centre, and have joined with ACHS members and facilities and universities to be able to look at this as an approach for the future. So I think there are many exciting things ahead in safety and quality and in accreditation, and we are very much looking forward to leading some of these approaches into the future. Thank you.
Thank you, Dr. Luxford. And I think we can all agree, especially given what we've seen during the pandemic, that safety standards and accreditation are incredibly important for hospitals in order to continue providing high quality care for their patients. Now let's get right on to the Q&A portion for this section. And if any of you have any questions for Dr. Luxford, please send it across to us in the chat box, the Q&A the chat box there, and we'll get Dr. Luxford to answer as many of them as she can. But the first question, and we've got an audience question, is from Charmaine Marie Villa. She asked, how different is the approach on risk management with the reality of COVID-19?
That's a great question. Thank you. Look, I think the underpinnings of approaches to risk management remain the same. Really important to be able to identify risk, to be able to work on approaches to risk mitigation and follow through with the monitoring. Those fundamentals are still there. I think, Charmaine, one of the things that is probably different is the speed with which we need to be able to address issues that arise in risk management. And this is being seen by all organisations. The risks are changing. Initially, we thought it was on a sort of monthly basis, and then it became weekly, and then it became daily. So being able to respond quickly and be agile, I think, is probably the most important difference there.
Right, and we've got quite a flood of questions coming in. So thank you for all these questions. Keep them coming. So the next question, Dr. Luxford, does ACHS International offer telehealth accreditation, which is especially important during this time of pandemic?
Yes, absolutely, we do. And we're very excited to have signed members to our telehealth accreditation process. So, yes, either get in touch with me or our ACHS International team, and we are accrediting to telehealth standards.
All right, and we've got another question, this time from John Alejano. How can quality of care and patient safety be applied to home-based healthcare as we transition away from the hospital care for the new normal?
Mm. Yes, look, I think what we probably haven't acknowledged in the hospital sector is that safety and quality has been key for many services that have provided home care for a number of years already. So really taking the learnings from those organisations that have been providing community outreach for a long time is key. The fundamental principles still apply. I mean, what we've really found in Australia is that many of these systems were set up already because we were providing remote care. Being a large country and over many kilometres of distance, we were providing many of these services already, but they were largely on the fringe. What we're now seeing is that those standards being introduced in parallel for not only the hospital system but for the groups who are already providing home care. So fundamentals the same, but some learnings to take from the groups who have been providing already. And I think probably one of the key differences has been the use of telecommunications technology and making sure that the standards and the privacy equally applies using a different technology.
All right, we've got another question. With COVID-19, virtual surveys have become somewhat more common and popular. How do you ensure that these virtual surveys can be as thorough and vigorously done as an on-site survey?
Yes, that's a great question, and certainly something that we looked at right from the outset. Our international team has put in place a very rigorous and comprehensive process. We've had to put in more resourcing, so we've put coordinators in to be able to make sure that we are well established, well set up. We've got the technology working right, but there are so many different techniques that you can use to be able to have eyes on an actual service nowadays and be able to really see remotely, make sure that all the documentation and evidence is available. But we have had very good feedback in terms of how these processes have been working from our members, and they're very supportive of this approach. And certainly our assessors are saying that they can manage to see and gain access to all the areas that they need to access, and to do that remotely and also through hybrid models.
Great answer. Okay, next question. How do you see the future of accreditation incorporating performance data?
Yes, I think it's a great question. I think it will be a gradual process. I think that initially we'll see the ability to be able to pull performance data on safety and quality from the electronic medical records to be able to align with the standards and provide evidence of the actual improvement within an organisation. At the moment, many accreditation systems focus on policy and procedure. But I think as we move more towards outcomes, we need data that actually evidences that there is improvement occurring. And so being able to do that and pulling on electronic forms of data will support whether improvement has actually occurred or not.
All right. And someone is asking, how is the ACHS international approach to quality improvement different to other providers?
Yes, I think we've got quite a unique approach. We are certainly committed to partnership in terms of quality improvement and making sure that we are supporting our members as a journey rather than just dropping in once every 3 years and marking for compliance. We are really looking for that improvement approach and providing recommendations that support improvement rather than just tick, yes, you met a standard. How can you actually improve as a part of your continuous journey? And doing that as a partner, I think, is key to our approach.
Right. And next question for you. We've got a lot of questions coming up. How do the quality and patient safety group work for the hospital? And are there any strategies that you can provide for them to follow?
So the quality and safety groups are a really important part of your governance backbone for the organisation. And I think to give them the absolute importance that they require, they really need to be reporting through to the peak governance body, so to your board preferably, and having that reflected in the board agenda so that it's not solely or fundamentally finances that the board talks about, but I think some of the best organisations have safety and quality as number one on their agenda at the board level as well. So setting the terms of reference for the committee, making sure that you've got a range of different people involved on that committee. A number of exciting organisations include consumer representatives on their safety and quality peak bodies, and that there is that regular line of communication not only to the board but to the whole organisation. I think one of the mistakes that health services can make is relegating responsibility for safety and quality to one person or one committee when we know that it's absolutely everybody's responsibility. So how do you integrate that in an organisation and also make sure that it is getting its due recognition at the most senior governance level?
All right. I hope that answered your question. Our next question comes from Naro Kong. And do you have a checklist for online assessment for health accreditation?
So we do have the ability to self-assess, if that's what you're asking, Naro. So probably best to get in touch with our international team. More than happy to connect you, either if you connect to me or to Michael Giuliano, who's our Executive Director.
Right. And we've got this question from Tutik Sri Hariyati. Could you explain the hospital accreditation process during the pandemic in Australia? Because you were saying in some countries it was pending until the pandemic actually happened.
So we have a national approach to accreditation within Australia. And at the beginning of the pandemic, it was actually put on hold. And the government pressed the pause button for a period of time. And accreditation was recommenced in October last year and has been occurring now on site. And when there are outbreaks, then there has been a change to hybrid and to virtual approaches. Internationally, we did a similar thing. We paused at the beginning of the pandemic, but we very quickly moved to a model of virtual and hybrid, and that's been ongoing since.
All right. Thank you, Dr. Luxford. I think we've got other questions, but we have come to the end of the session, unfortunately. Apologies to Iqbal Yusuf. I know you asked the question. But if any of you would like to get in touch with Dr. Luxford or any of our team at ACHS International, please click on the sponsors tab have a chat with them at their digital booth. They're really friendly and they will give you all the information that you need. So thank you again, Dr. Luxford. And Dr. Karen Luxford is the Group CEO, the Australian Council on Healthcare Standards and ACHS International. Thank you, Dr. Luxford.
Thank you very much, Noah, and thanks to everyone for your great questions.
All right, so we've come to the end of the morning session of HMA 2021. We'll take a break for lunch now, but please do join us again in about 15 minutes time, which will be at about 12:30 p.m. Singapore time for the rest of the day's sessions. Have a good lunch and I'll see you again soon.